Okay, here's the second installment of the PowerPoint lecture series for urban sociology on rural mental health care and rural mental health issues. This is the last slide you saw, so we're going to move ahead. And again, just like always, or like on the first one, you need to take notes on these and have these. These are going to be important for you to have for the exam for sure. Research has identified 2,000 mental health professional shortage areas designated in non-metropolitan areas. That's a big shortage. This affects more than 66 million non-metropolitan residents or rural residents. It's estimated it would take more than 1,500 practitioners to remove that designation. To further complicate the challenges of providing mental health services, the most disadvantaged and under-resourced communities are often those with the biggest need for mental health care providers. So again, in these rural areas where you have a shortage of mental health care providers, that's where you often find the biggest need, and especially when it comes to clinical depression and when it comes to anxiety-related issues. A travel distance, unavailability of public transportation, and lack of insurance are commonly identified as challenges to assessing health care in rural areas. Some folks who live in rural areas, while they may have automobiles, maybe they do, maybe they don't, even if they can't get there with their own automobiles, they may have to rely on public transportation. Public transportation is, as you can imagine, a real issue in rural areas. They don't, these public, buses, trains often don't go into rural areas, so it creates more barriers. Reimbursement issues and the social stigma of receiving mental health services are significant challenges that affect access and provision of mental health services in rural areas. And we've already talked about insurance. Professionals don't want to provide services if they know there's a good chance they will not be reimbursed, because if they can't make money, they can't make a living, then it's, what's the point? So it's an unfortunate situation. Reimbursement offered by such payers as Medicaid, Medicare, and private insurers has a significant impact on the availability of rural providers to offer mental health services. What you find is that rural health clinics may be reluctant to start providing mental health services because the reimbursement rates are so poor. They can't make any money. Also, what we're finding in the research is that you have a high rate of no-show. In other words, people making appointments but not showing up, or scheduling follow-up and never coming back. And this creates high numbers of uninsured patients, which further makes it a problem, or further exacerbates the issue of low reimbursement rates paid by Medicaid and others. Stigma. Again, I defined a stigma for you. You've got a nice little definition there. It's a mark or characteristic that indicates abnormality. I'm going to define it as an attribute or characteristic that is deeply discrediting to someone. If you ever read the novel The Scarlet Letter by Nathaniel Hawthorne, if you remember, one of the characters, Hester Prynne, had to wear the scarlet A because she was an adulteress. If you don't know that story, it's okay. But if you do, that gives you an idea. It's something that's deeply discrediting, and there are many misconceptions, myths, and taboos associated with mental illness, and these may be the most significant barriers that keep people with psychological problems from seeking and receiving treatment in these rural areas. There are a lot of misconceptions about mental health. I want to come shy of saying ignorance, because that's going to imply that people in rural areas are more ignorant than people in urban areas, and that's not exactly what I'm trying to say. But there does seem to be more misunderstanding and more fear of being labeled in rural areas, and maybe these are, again, some reasons why people don't seek these services when they really, really need them, and in some cases more than people in urban areas. Factors that may make people feel ashamed of their mental health issues and avoid seeking care in rural areas or in urban settings alike include, first of all, lack of understanding and knowledge of mental illness, sometimes even among healthcare staff. Sometimes medical care staff, and I've worked as a psychologist myself, have worked among healthcare staff who have no idea about what mental health disorders really are, or how impactful they can be, or the significant effects they have on patients and their families and their loved ones. Prejudice, second of all, towards people with mental health disorders, based often on fear and unease. I don't have to think too far back to come up with an example of someone who is prejudiced toward people with mental health disorders. I had a person who told me once, I was working a job, I was in a position to hire people, and this person told me that he was uneasy about hiring a woman who disclosed that she had suffered from depression. He told me that he felt like she was automatically going to be depressed forever, and then at some point was automatically going to become suicidal, and then he was going to have to deal with that in his workplace. Well, there's a lot of ignorance there with what he was saying. First of all, if someone is depressed now, doesn't mean they're always going to be. In fact, it kind of comes and goes. It's recurrent. And just because someone is depressed does not mean that they're going to think about or attempt suicide. So there are prejudices and then discrimination toward people with mental health disorders. And this is exacerbated in rural areas. And then secrecy about mental illness in the community and general hesitancy to seek care. Now, because of their small size and close-knit societies, rural communities are known for knowing everybody. Kind of like Cheers, where everybody knows your name. Well, in a small town, everybody knows everybody's business. Patients entering mental health clinics or mental health facilities, they're more likely to be seen by people they know, as opposed to a big city. You could walk in and chances would be no one would know you, and even if they did recognize you, you probably wouldn't have a tight relationship with them. But there's more of an issue of visibility, being seen, and then being talked about, perhaps. So this is another barrier to treatment in rural areas. Familiarity, such as this, can cause mental health care seekers to feel insecure and question confidentiality and privacy, which could, again, get in the way of them wanting to seek help or to seek care. I'm just checking something out here, guys. Okay. There are drawbacks to small communities when it comes to mental health. There can be some positives. Close-knit communities can also mean that residents will rally around each other and provide that support. If you remember the Gemeinschaft and Gesellschaft concepts, in small communities in rural areas, people tend to kind of stick together more. So there could be a rallying behind people with mental illness. So this could be a good thing, where you would probably not have that as much in bigger cities. So what can rural communities or healthcare facilities do to minimize the challenges of providing mental health services in rural areas? There are lots of different things. I'm going to summarize them with 3 things here. There are several approaches that can be tried in rural communities to minimize the challenges. First of all, and this is something that I use, telemental health services, or this is also called telemedicine. Instead of having doctors have to locate or drive to these rural areas, the use of satellite TV, where doctors can actually, or telemedicine, or there's something called Zoom technology, there's something called Polycom. These are all different ways to exercise telemedicine, where a psychologist or a counselor can actually work from his or her office in a rural or in an urban area, it doesn't matter where, many states away even, and see you on a television set and offer you care, offer you counseling, offer you therapy. And that way, that kind of takes away the need for physical bodies in rural areas of physical professional providers being there. Now, the drawback is that you are talking to someone on a TV, but the bigger drawback is it can be expensive to set this technology up in rural areas. And then to maintain the equipment, it might be expensive, and you need some knowledge and expertise, which may be lacking in some of these areas. Offering loan repayment programs and state tax waivers could be another practice to deal with workforce issues, lack of people wanting to work in rural areas. And then providing for clinical rotations in rural settings to pretty much grow your own workforce. If there's visibility there and people see that there are people working, professionals working in these rural areas, then others in the area may want to aspire to work at these clinics and in these hospitals. And we'll call that the end of the second part, and that's the end of the lecture for rural mental health for urban sociology. Thank you.